Hi guys, welcome. So this week I am talking about vaping and e-cigarettes for week 5. So let's just jump right into it. So, epidemic factors. The prevalence of e-cigarettes and vaping, as you both guys should know, or if you don't know, e-cigarettes are the cool little things that these young teens find very popular that have the liquid that they can smoke, whereas vaping, I found in resources they kind of were like interchangeable with when they were talking about e-cigarettes and vaping. So I'm going to assume that they are the same in a sense, just kind of created differently. E-cigarettes, as I said, has a liquid in them that kind of burns when you smoke it, whereas vaping has a different flavors. They have these like cute little designs on the little handheld things that they use to smoke. So the prevalence of e-cigs have definitely increased in the US, targeting the adult populations from ages 18 to 24. But there has recently been an increase in popularity and convenience being appealing to our middle school and high school kids. Crazy, right? Um, Teenagers have become very, very familiar with these things, or they're more exposed, and so it's definitely have hit as a boom in that generation. In 2022, 2.55 million reported use, resulting in 14.1% in high school students and 3.3% in middle school age students. And the major thing for them was the flavor and the use of them being disposable. That's what really hit it off of being very prevalent as far as incidences here in the US. Youth responded that 27.6% utilizes e-cigarettes daily, whereas 42.3% youth explains that out of 30 days, 20 of those days they are using e-cigarettes and vapes. And I found that e-cigarettes are the most common use for the smoking factors of these younger generation. February of 2020, it was reported that there was over 2,900 hospitalized cases and or deaths in the U.S. 68 deaths were confirmed in 29 states, including D.C. I found this kind of interesting because as I was reading, it didn't really talk about many deaths associated with e-cigarettes and vaping, more so as lung disease. As I go further into this, there are definitely risk factors that prevent lifelong issues with this whole vaping and e-cigarette use. So factors in Virginia. In 2018, 4.9% adults use e-cigarettes. And again, adults were ranging from 18 to 24. In 2020, 3.4% use smokeless tobacco. So the thing that I found about e-cigarettes and vapes, they have, whereas you can have this THC, nicotine, and then there are some vaping mechanisms that do not have nicotine and tobacco in their filtration. So that was one thing that they pointed out with the use in Virginia. In 2019, 19.9% used vapor products within a month. The prevalence of the use of e-cigarettes or vaping in Virginia has increased among the younger population. It's become more prevalent in our younger teens. As you have saw on the first slide, as in the US, vaping and e-cigarettes are like the new hit thing for the younger generation. It has been reported in Virginia that the use of e-cigarettes or vaping has caused injury to the lung with a total of 35 reported cases. So as I mentioned a few minutes ago, death wasn't really a huge known thing with e-vaping and e-cigarettes and vaping, but there are definitely lung injuries and lung diseases that are becoming more prevalent and you see more incidents as hospitalizations are occurring due to the use of vaping and e-cigarettes. So risk factors, maternal use, right? Because that's why we're here, right? So for moms who decide to smoke, definitely toxicity is something that we find in women. Inflammation, oxidative stress, respiratory and neurological effects, renal impairment, that's renal disease, renal dysfunction, and fibrosis. For perinatal, we find that there is compromised placental function, postnatal increased risk of short and long-term respiratory morbidity, asthma development for the baby, and definitely lung injury, again, for both mom and the baby. For fetal risk, there are fetal structure abnormalities, nicotine dependence in the youth, trophoblast impairment and angiogenesis function, which can compromise the placenta circulation within mom, intrauterine development issues, respiratory and neurological effects. There are learning deficits, short-term memory loss, anxiety and behavioral issues, as well as low birth weight and preterm birth. So there's definitely risk with smoking. So again, I found in reading and doing my research that nicotine associated is really hard to pinpoint what are effects are going to happen if you decide to continue to smoke while being pregnant. There are definitely teratogenic issues with substance abuse, as I'm talking about vaping and e-cigarettes. But to really pinpoint the nicotine association, there's still being research done. But the best thing that we can tell moms who are smokers is to educate. And again, I'll talk about that further on in here. So screening tools. There are 3 screening tools that I found that they use to decide the validity and reliability of these tools for e-cigarettes and vaping. Is the e-cigarette dependent scale, the Penn State Cigarette Dependence Index, and the FTCD, the Fagerstrom Test of Cigarette Dependence. So these 3 test screening tools basically are going to screen individuals who have a higher nicotine concentration, their physical dependence to using e-cigarettes and vaping, and their overall function. And I also talked about the Wisconsin inventory of smoking dependence motives as well. And that talked about primary dependence versus secondary dependence, right? So what these three tools are utilizing, they're seeing like, what are your craving? What are your urges? What are your sensory? What are your cognitive enhancements? What are your tolerance to the use of e-cigarettes and vaping? What are your addiction, basically? You got utilizing these resources that I use to conduct this presentation. People that use vaping and e-cigarettes, it's kind of like a motive. It becomes an addiction, and you have to figure out, so what is that motive? What is that addiction? Why do you result to using, right? This substance abuse in a sense. So the use of these tools, basically, that all 3 tools measure the significance of self-reporting dependence and its daily effects with the processes. And what I mean by that is, how does using e-cigarettes and vaping affect your everyday processes of life? How does it affect your work? How does it affect your everyday routine? How does it affect your relationships, your family dynamic? How does, your cravings, your urges, how does this affect? So that's what these 3 tools were basically getting a gist out of, as well as the addiction, the heavy use, the continued use, the early use, the prove that you have strong outcome after deprivation. After you haven't used it, how do you result back to it? So basically, we were trying to figure out your dependent on the e-cigs and vaping with using these four tools. My bad, I said 4 tools. And it also showed that the validity of the 3 basically provided you insight of an individual with their use, their continued use, their addiction. How much are they using? How much tolerance do they have? How much dependence do they have to having to have a vape or an e-cigarette? As well as the reliability. The reliability of the 3 chosen tools provided insight, accurately providing measurable responses. So basically, the different resources that were used to look at these 4 different screening tools, you will be able to conduct you'll be able to test and see individuals who are vapors who use e-cigarettes, their responses to being dependent on vaping and e-cigs. I hope I said that right. So a presentation of the patient. So when you see mom, or you see the first time individual that's coming in, not sure if they're pregnant, there are subjective and objective presentation mechanisms that you can basically tell about their substance abuse. So subjectively, they can report chills, they can report chest pain, shortness of breath, abdominal pain, nausea, vomiting, and diarrhea. Objectively, we can get vitals, of course. You would see their with vital signs, you would know if they have a fever or their oxygenation impaired, weight loss, cough. And also a lot of times the individual will be attended, sleepy, and agitated, smell of substance, and they will have poor dentition mouth. Your mouth tells everything. So when you look at an individual, you're observing, You're doing your assessment. These are key factors that you can utilize, that you can tell just based off physically talking to the person, examining the person. How well put together are they? Are they making eye contact with you? Are their pupils dilated? That's another objective key point. Are their pupils dilated? Their skin, what does their skin look like? You're looking at their fingers. Those are key indication, objective findings that you can get. Subjectively, let's be honest, they're not always going to be honest with you. And it's fear. It's fear of, if I tell you that, yes, I use substances, or I'm a smoker, it's that judgment, and it's that fear of, oh my gosh, are you going to report me? So subjectively, you may not get so much besides, oh, abdominal pain and the things that I listed, but objectively you can gather more. But if you provide that safe space for that patient, you can get a whole lot more information as to what exactly is going on, which is very important for the safety of the mom and the baby. So differential diagnosis, of course, as I mentioned prior to the beginning of this presentation, with e-cigarettes and vaping, it is very hard to say you died from vaping or you died from e-cigarettes. You're definitely going to have comorbidities that affect you long-term. And in those long-term things, you'll see you can have hemorrhage, pneumonia, diffuse alveolar damage, acute fibrinosis, pneumonitis, lung injury, and bronchiolitis. So these are key indications of differential diagnosis that can occur with you being a substance use abuser with e-cigarettes and vaping. Prenatal care. So overall, with all 3 trimesters, first, second, third, postpartum, after, you're going to continuously provide education, you're going to continually provide counseling, and you're going to continue to monitor. It is very, very, very important to not just think that each trimester is separated. They somehow or another, they're going to intertwine with each other. And that's something that I figured out doing my research. So with the first trimester, you want a very comprehensive medical history. Getting that comprehensive medical history is going to provide the information thereafter, right? So that comprehensive medical history is going to give you the details that you need to figure out the plan of care going forward. You're going to do a physical exam, and that does not always mean physical exam, but that just means like your vitals, assessing different things, getting the intake that you need, but an exam that is necessary for you to get the necessary information, basically. Early screening. I can't say this enough with smoking cessation and getting that information about that person. Early screening is going to be definitely a key point that happens first trimester, straight off the bat. You want to do that early screening. You want to provide smoking cessation information and resources, even if they don't admit, in that first instance, in that first introduction to one another, they don't admit to them being to use smoking or any of these substances. Provide that. This is smoking cessation. This is something that you need to know. This is vital information. You want to educate the partner. You want to educate the family. You want them to all be involved because that's your psychosocial. The people that you have as your support system need to be aware and be made educated. If you're not the smoker and they're the smoker, they need to know information as to how secondhand smoke can be harmful to the mom and the baby as well. You also want to cancel about the risk of smoking. Even if they're not smokers, if they don't want to admit to it, still provide that with your smoking cessation and resources and information. Cancel about the risk. Cancel about prenatal substance abuse education. Educate, educate, educate. That's what I keep saying, right? So it's very important in your first trimester to educate, lay the foundation. Laying the foundation is the key to continue to build to the next trimester and hopefully build that rapport where that patient feels comfortable enough to share that information with you. So that's first trimester. Moving on to second trimester, you're kind of getting to know each other and you have hopes of them providing them behavioral counseling. What does that look like? Behavioral counseling can be a multitude of things. Primarily, again, you want to educate about prenatal substance abuse. You want to provide more screening, still provide more education for the partner, how their behavior is, how's that patient being presented to your office, what are their behaviors? Are they distant, anxiety, withdrawn? Let's talk about it. Educate about nicotine replacement if abstaining fails. I read in a resource that if they can abstain at least for the first 15 weeks, that is your major time. Is very sensitive for the development of the fetus. If they can maintain from abstaining from substances and smoking for 15 weeks, we're golden. But if all else fails, let's have an education about nicotine replacement. Now, there are resources that says nicotine replacement is kind of unknown of the validity and reliability of the safety of these replacement drugs that can be used. And there are like bupropion that are like pregnancy C category for drug use. So you want to be careful. You want to provide the education. Again, you want to give the risk and the benefits about it. But let's talk about the importance of really the fetus development and then your overall health at, once birth appears. So then again, that goes back to educating, counseling, and monitoring. Again, it's very important, all 3 trimesters. Getting to the 3rd trimester, biological testing for birth preparation. This is important for those who need pain medication during birth. You want to make sure that if a mom is a substance abuse user, again, that leads back to their tolerance and their dependence. How will this affect mom during birth and after? Because you have to worry about once baby's born, relapsing. So this is going to be important to have these conversations, build that rapport, provide that safe space so that mom feels comfortable enough to provide the information. So biological testing for birth preparation. Let's talk about contraception, educate about postpartum relapse, postpartum education, providing them substance abuse specialists, and then providing them peer support groups. A lot of time, individuals will speak to those who they can relate to. A lot of times they can't relate to the physician. They cannot relate to who their doctor is. Yes, I understand that you want to help me. You hear my story. You say that you sympathize. You say that you empathize, but do you really? So sometimes providing those resources, you have to think outside the box. What else can you do to assist your patient? Providing them peer resource. Provide them individuals who have been through the same thing so that they can say, hey, you don't have to feel like judgment is on you. There are people who have been through the same thing you've been through. So definitely provide. That goes back to educate, counseling, and monitor. Very important. Other aspects that are like your psychosocial, psychological, I spoke about. Provide resources for transportation. Important. Providing safe housing. Important. Food security, contraception, childcare. These are important resources, things that you can provide for support for individuals who don't have that. Think about the moms who are substance abuse users, family have disowned them, they don't have a partner, they feel alone, so they resort to vaping, e-ciggs. That's their way of coping, get away, feeling whatever high that they want to feel. Providing them these little resources can be very significant. Contraception is definitely going to be something important to discuss. Food security, we all need food. Housing safety, definitely important, and transportation. How are they going to be able to get to and from to these appointments, to support groups? So let's give them information, provide them one lesson they have to worry about by saying, hey, this is an issue that you have. Let's get this set up. And then legally. So legal, talking about this in prenatal care, it's kind of touchy. As I touched back, a lot of times, a lot of women do not provide and give this information subjectively because they feel as though they're being judged. And then they're worried about reporting, getting services involved that could potentially take their babies away, putting more, insight or a highlight on things that they just did not want to. They want to keep more personable than, just giving it, providing information that they just don't want to tell. So legally, we're not here to, you're going to get in trouble, we're going to send you to jail, you use drugs, but we definitely have to focus on the safety of mom and the baby. That's important. That's first and foremost. And that's something that you have to figure out as a provider. How do you articulate that to an individual who is fearful? And that's the reason why a lot of times when it comes to the legal aspects of vaping and e-cigarettes, it's legal. So you can't say it's illegal because it is legal, but legally, well, I wouldn't say legally, but what responsibly is something that you shouldn't do while pregnant. There's not a lot that supports it that says, oh, nicotine's bad, you're not supposed to do it. There are teratogenic substances that you're not supposed to, that people abuse. But as I mentioned, with vaping and e-cigarettes, it wasn't that much resources or support that says absolutely not. It's advised not to, but there wasn't anything that said absolutely not. So again, providing information, educate, counseling, and monitoring are going to definitely be 3 key aspects throughout prenatal care that you provide while monitoring, evaluating, and that such thing. So here are my references that I used. I hope you guys enjoyed. I hope you guys understood. I hope I articulated so that you guys can have enough information for the upcoming midterm. Bye.